Early last April, I had an appointment in the Halifax Professional Centre at the corner of Roby and Spring Garden Road. A block from the medical school, the building has a lot of doctors' offices, including allergy specialists. Waiting for the elevator, I faced a bright and beautiful ad for allergy drugs that covered the 2 doors of the elevator just in time for allergy season. I told the receptionist that I was pretty sure the ads were illegal, who had authorized putting them up. She told me that the building was under new management and the new owners, a consortium from away, did pretty much what they liked. I mentioned it to my doctoral student, Sharon Batt.
Janice was pretty upset about the ads. She said if they were illegal, we should take some action. The next day I went over with my camera and took photos of them. They were so big and in your face. Anyone waiting to take the elevator would have no choice but to stare at them. I didn't know if the drugs are over the counter or prescription, but I knew someone who would. Barbara Mincy's at UBC, a leading expert on direct-to-consumer ads and regulations. I sent my photos of the ads to Barbara, and she replied immediately that both drugs are made by the same company, Schering-Plough. Arius is over the counter, and Nasonex, a nasal spray, is by prescription. The company is cleverly using the 2 ads together to promote Nasonex, Barb explained.
The ad on the left legally says that Arius, the over-the-counter drug, is for allergies. The ad for Nasonex, the prescription nasal spray, takes the form called a reminder ad. It promotes the name of the drug, but doesn't say what it does. As Barb explains, the 2 ads together become a full product ad. They tell you the condition, allergies, and promote a prescription drug remedy. Nasonex is a prescription drug because it is not considered safe enough to use without a prescription, but Schering-Plough is using the ad to increase sales.
When I Googled the name of the landlord, Northwest Healthcare Properties, I learned that it is a real estate firm in Toronto that calls itself Canada's Healthcare Landlord. They own a lot of buildings all across Canada, including one in downtown Dartmouth.
So I arranged a meeting with Doug Sinclair, the Associate Dean of Continuing Medical Education, who's a doc with an active interest in academic detailing.
Well, this was a very interesting incident we had. I went over and looked at them myself. I just couldn't believe what I was seeing. So there was a number posted for the building manager, so I wrote that down and went and called the secretary, and she said, "Oh, those ads." And so obviously she was aware and passed me to the building manager, who I talked to and explained the issue with the ads and our concern from the medical school that really patients and families were coming to see physicians and other healthcare professionals. She actually agreed with me, and she said, you know, we didn't really feel comfortable with this, and she had a gut feeling that something wasn't quite right, but this was a national campaign that was really imposed from Central Canada offices, and she was actually quite happy to withdraw the ads within her jurisdiction. And what was interesting is I said, well, what's the corporate view of this? And she did admit that the direction she was given, if that people complained about the ads, they would be withdrawn, but there wasn't going to be a national program to withdraw the ads. And then I walked by there a couple more times, and within a week, the ads were gone.